Hello and welcome to LINNC Paris 2022. And today we are with Dr. Rodrigo Rivera. Thank you for being with us. You are working now in South America. Could you tell us a little of how stroke is playing out there, stroke treatment?
Well, thank you for the interview. Well, South America is a very special place. There are a lot of countries, developing countries, so stroke has been quite difficult in the last year to develop. We have been a little backward from the rest of the world, I think. But since 2015, that the development of the mechanical thrombectomy, all the rising of the mechanical thrombectomy, I think we have been developing in several places with several local people, different.
A kind of logistic to get people?
Logistic, yeah, for sure, logistic to get people involved in stroke. So there are some countries like Brazil that are ahead. They did an excellent randomized trial that is called the Resilience, so to prove that the mechanical thrombectomy was effective in a special country like Brazil, and that could resemble also all the different countries around. So
Right.
we have similar population, similar incomes, so politics. So it could be repeated around all the regions. So we also in Chile we have been working hard with stroke, and we have been working with the Minister of Health and other societies in order to make guidelines and to work with the neurologists and organize the Chilean situation in order to treat these patients. Now we have a network. It's working. It's based on neurology, so that's very good because it's the base of the treatment. And we are still lacking in different places around all the country for the mechanical thrombectomy because it's a time-dependent disease, so you need people in special location, and Chile is a long country, so it's difficult to have people in the north and the strokes on the south of Chile. Everyone is concentrated in the center, in Santiago, it's the capital, so there's a lot of people there, but we don't have many interventionalists in other part of the country. So that's one of the thing that the task force that we are working in the next years.
I think that's a challenge in actually every country with a large geographic area.
Yeah,
and,
sure.
And I'm curious because there's a two-edged thing there about education. There's the educating and experience of the physicians such as yourself, but there's also the population. How is the population in South America? Are they aware now that they can treat stroke? Are they aware of the...
They're becoming more aware because there's a public campaigns that are going on from the ministry. There's always not enough, so we need more campaigns. We need more education because there's still people not recognizing when they should go to the hospital.
So it's a double problem.
And not only the patients or the people, but also even though the personnel at the hospital, they're not too aware of what it means a stroke. Everybody knows what a heart attack is, but
the stroke,
but the stroke is still, we have to
educate everyone
inside the hospital and outside the hospital. So that's a challenge.
Well, thank you very much for talking about this with us.
Thank you.